Imagine you're receiving this admission page for a patient ZZ Mouse, the diagnosis of river snail overingestion. This is the type of page you should receive from the admitting office at the VA to let you know you have a new admission. You'll note here also it gives the team designation as Team E, and the attending is Dr. Brew, which is information you'll need to know later when you're placing admitting orders, and adding a cosigner to your H&P. Once you receive a page like this, you can open CPRS and start your admission orders. First, you'll need to note the patient's location, however, which you can see up here in the location provider location box. This will indicate where the patient's administratively located, not necessarily where they're physically located. Options might include the emergency department or a ward such as 2 North or 2 South or AG. The patient we're looking at here is an imaginary patient currently located on an imaginary ward called 10CN. When you're placing orders on your patient, you need to make sure that the patient is admitted administratively to a ward. Otherwise, all your orders would be lost when the patient moves to that ward. You can circumvent this requirement if the patient is in the emergency room. You can write what are called delayed orders by clicking on this box here. This means that you write a set of orders that are activated when the patient moves. For the purpose of this demonstration, our patient is already located on the floor, so we'll write orders the normal way. The way to write admission orders begins with the Orders tab in CPRS. On the Orders tab, you note a number of order shortcuts over on the left-hand tab. The one we'll be working with today is WX Physician. This is the home base for most of the orders you'll write, and it includes admission orders. So we click on that, and we get this window here. Over on the upper left side are all the orders you'll need to write as an admission order set. This is just bare bones admission orders. It doesn't necessarily include medications or other things that you may need to order later. You'll need to click on everything in this upper left-hand side in order to get the patient admitted. One way to do this is to hold down the control button on the keyboard and click on all of these orders that you'll need to do as part of the basic admission order set. So I'm holding down the control button on the keyboard right now. I'm going to click Admit, Team Assignment, Diagnosis, Condition, Allergies, Vitals. My imaginary patient doesn't require a Foley catheter, so I'm going to skip that one. Call House Officer, Activity Orders, Diet Order, if I know whether or not the patient can eat or not currently. And I'm going to put in VTE prophylaxis as well. So as I'm holding down Control, now if I release the Control button on the keyboard, it's going to go through this order set of all the orders I clicked. Important to note, within that page that you initially received from the admitting office will contain whether the patient should be admitted to observation or inpatient. This is actually an important administrative designation that we need to keep in mind when we're admitting patients, because it has to do with reimbursement for the hospital, which may seem not immediately clinically relevant, but if you put it in the order incorrectly, your patient could lose all of his orders, and an administrator may bug you to change it later. So it's important to pay attention to this up front, whether it's OBS or regular admission. My patient with a river snail overingestion is clearly warrants inpatient treatment, so I'm going to click Admit Patient. As we mentioned before, this patient does not require delayed orders, so I'm just going to go over up here and click Next. Next thing the set comes up, you'll note Team Assignment, Team Change comes up. And we said this is Medical Ward Team E, as was contained in that page. The attending is Dr. Brew, so I'm going to type that in, Anthony Brew. The intern is me. And you're going to put your pager number in here. Accept that order. It'll move on to the next, which of course in this list here, we're going down linearly. The next is diagnosis. Then next is condition, of course, stable. For allergies, patient has no allergies, so I'll click next. Vitals measurements, I usually click routine vitals per ward policy. Then click next. Call house officer, I'm going to keep all the typical default parameters. My patient can be ad lib for his activity order, so I'll click that. Click next. And my patient is going to be NPO, since he's having a difficult time after eating so many river snails. I'll click accept order on the diet order. Click next. For VTE prophylaxis, this is not a spinal cord injury patient or SCI patient, so I'll go through this algorithm. This is just some decision support on whether or not to order and what kind of VTE prophylaxis to order. I'm going to say that my patient is not ambulating outside his room at least twice a day. So he's at intermediate risk. It'll give me some suggestions on what to order here. He has no absolute or relative contraindication, so I'll say that. I'll be ordering subcutaneous enoxaparin daily. So give me an order check here based on his creatinine. It's okay. And click OK. So now these orders are pending right now. I haven't signed them yet. In order to sign them to get the patient admitted, I'm going to go up here to the top and say Review Sign Changes. Now if you started your note at this point, it's important to look through all the orders that are in here and uncheck that box if you're not ready to sign your note yet. Otherwise, when you sign all these orders, you may sign your H&P prematurely. Since I haven't started an H&P yet, I'm okay to sign all these orders and get the patient admitted. So I enter my electronic signature code and click Sign. Now the patient has a set of admission orders here. So next, I'm going to start my H&P. I'll go to the Notes tab, click New Note. Among your list of options should be Admission, History, and Physical Exam. If it's not there, you can just type it in. Admission, History, and Physical. Click that. For you guys, there should be a box here for cosigner. Since I'm an attending, I don't have a box there. But for house staff, we'll have a box there, and you should enter that attending to which it was originally assigned. As you remember, it was Dr. Brew. When I go through the admission H&P, I start the note, it's going to prompt me with a template here. This window that just popped up. In VA speak, this is called a boilerplate, which means it'll prompt me for some information which will help populate my note. This patient's being admitted to medicine, so I'll click that box. As we already decided, the patient is at moderate risk for thromboembolism. I'll scroll down here. I have reviewed all the medications, as we should with all patients on admission, so I'll click Yes. I think this is helpful to check this box of VA medication list, because this will pull in all the meds that are listed both at West Roxbury and remote VAs into my note. Now once it pulls in that list, it can be a little bit cumbersome to read, and I usually end up retyping it, but at least this way it'll pull in all the medications that are listed as the patient having been prescribed. You of course still need to verify all these with the patient to see what they're actually taking. So once I go through this, I'll click Finish. And that populates a basic note for me here, which pulls in, as you can see, the latest vital signs and a scaffold for what I'm going to write for my H&P. So then at this point, you'll go ahead and, of course, type up your note. Make sure the medications are reconciled, and you'll go ahead and sign your note. The way you'll do that is go to File, Review, Sign Changes. You can see here Admission, History, and Physical Exam. And once you're done, you can sign it. If you're not ready to sign it, just uncheck this box, click Don't Sign. It'll save your note for you. That note doesn't go anywhere. It still says it's unsigned notes, and you can still work on it later if you need to be, if you're pulled away to deal with something more acute. You want to come back and sign it, right-click the note, click Edit Progress Note. And then I'm going to go ahead and sign this. And that's how you admit a patient. Hopefully our patient does well despite his river snail ingestion.